Okay, good morning, everybody. Sorry for the delay. We had technical problems getting one of us on, but now we're all on. So thank you for being here today during such a busy time of year. At this time, I would like to open today's Board of Health meeting for Thursday, December 23rd, 2021. Present on our board are Jennifer Inferna, Maureen Pimentel, and myself, Kathy Donahue. Before I move to our first agenda item, I would like to acknowledge these incredibly difficult and challenging times that we are all experiencing. I am so very thankful for our strong and courageous community, and together we will get through this. Before we open up for discussion, I'd like to acknowledge why I called this emergency meeting following our previous meeting on December 14th, where it was voted 2-1 to rescind the mask mandate. Currently, we are going through an extensive surge in Winchester. Since Sunday, we've added 49 new PCR cases. That was as of yesterday. And the week before, it was 55 cases. And the week before that, it was 66 cases. Our current positivity rate is 3.2%. Governor Baker also just recently had a new mask advisory recommending that all residents, regardless of vaccination status, wear a mask or face coverings when indoors publicly. This obviously is new from before, when it wasn't required for vaccinated people. Holiday travel, more inside group gatherings, significantly increased opportunities for transmission exist, which we did know as of the last meeting as well. In addition, the Omicron variant, our knowledge of the Omicron variant has evolved. We now know that Omicron variant is much more contagious than previous variants, and it appears that those who have not yet had a booster may be more susceptible to getting the virus. We also need to protect our most vulnerable population in Winchester. So what does this mean for Winchester specifically? I believe we should reinstate the mask mandate today, and this is why. It is knowing that mask wearing is important in conjunction with other mitigation strategies. It reduces respiratory illness transmission, including COVID and Omicron, as well as other variants. It helps to preserve our healthcare capacity in our system. It helps to keep our businesses and schools open, and it protects the most vulnerable people in our community. Finally, before we move into our discussion, I would like to share an email the board received from Dr. Richard Weiner, president of Winchester Hospital. He states that our hospital is being inundated with COVID patients. About half of these patients are vaccinated. The consensus is that they became infected because they or someone else, or both of them, were unmasked. He goes on to say, there is not a lot we can do to prevent the spread of the virus. We need to do a few things that we can. Wearing masks is one of them. Please reinstate the indoor mask mandate. It will save lives. So on that note, let us begin our discussion with our board members about reinstating the mask mandate. I'd like to begin with Jennifer Inferna, if you wouldn't mind.
Sure. And before I talk about that, I did want to make a couple opening remarks.
Sure, please.
So there has been a lot of misinformation conveyed through social media channels and otherwise this past week, and I would like to address that. But first, I do want to thank all of the Winchester residents who took the time to write thoughtful comments to myself and our board member this week. I would like to clarify that due to open meeting law, I cannot share any of my thoughts or information that could be considered a deliberation of issues in front of the Board of Health. Some residents have asked why or what was the rationale, or would you agree to this, that, or the other? I cannot respond to those questions unless I am in open meeting with the other Board of Health members. So I apologize that many of you have not received a response from me yet. This is not how I like to conduct business, but you will, and please know that the canned nature of the response is all that I am permitted to say. I would encourage residents to take the time to watch our last board meeting, the video recording. I think it provides helpful context, or I'm happy to speak with you over the phone. but I still cannot necessarily share my thoughts in case they are repeated in places accessible to the other two Board of Health members. Second, there has been a lot of misinformation shared about things that I have said or not said. I stated in the meeting last week that I believe masks work. My only statement on the record prior to that about masks was in August 2020 in an interview with WGBH, where I stated that the reason I believe it was safe for kids to learn in school was because masks work. So the anti-mask rhetoric is simply not true. Second, I have not made promises to anyone about how I will or will not vote. Leading up to the appointment, I was transparent and had conversations with select board members, except Mr. Goluboff, who never responded to my emails, and with Board of Health members about my qualifications, my interest in the position, and the process for appointment. When I was asked about my thoughts on the mask mandate, I was candid and honest. I said that although I believe masks reduce transmission, I do not believe that the current mask mandate is having an impact on transmission in Winchester, given there are no other restrictions in place, and neither in the majority of towns in Massachusetts. I also talked to board members about the need to change the public dialogue. And instead of focusing on case rates alone, I believe we need more public education on the benefits of the vaccine and that it reduces hospitalizations and deaths. People need to understand that we are not in the same place as last year with this surge. We have vaccinations as a new tool, and given the high vaccination rate in our community, and a vaccine that has been proven 97% effective at preventing hospitalization, I believe this is a key data point in the discussion about whether a mandate is necessary. We discussed this last week at the board meeting, and this was reiterated by the governor of Massachusetts and the president of the United States on Tuesday. Third, people have stated that I regretted my vote last week. I will tell you what these conversations actually were. One of our select board members asked me directly after the vote if I would agree to extend the mandate through January because public perception was bad around the timing of the vote. I responded that I would only consider extending the mandate, for example, if the business community needed more time for implementation or for other logistical reasons. I reiterated my reasoning that I have stated all along. A mask mandate alone, in the absence of any other restrictions, in a state with 300 plus towns surrounding that also have no restrictions, is not having an impact on transmission rates. That, combined with the lack of enforcement in our town, is not achieving its intended goals. These are the conversations that I had. But let me be clear about something. I don't make decisions based on the rising and falling tide of political opinion. I will not bend to political pressure or bullying on social media. I will make difficult decisions based on good policy, analysis, and collaboration with my fellow board members, regardless of how unpopular they are. I will not make decisions based on the political agenda of others. And that is the type of leadership that I would hope is supported in our community. So to set the record straight, I believe that masks reduce transmission. Our vote last week does not prevent anyone from wearing masks in public. Modifying the mandate to an advisory takes away the penalties and the fines associated with the mandate. That is it. In addition, the mandate was not being enforced in our town. We did not fine a single person the $300 fine imposed by the mandate over the 5-month period it was in place. Local businesses bore the burden of enforcement. Our town health department had to follow up on complaints that consumers were filing against local businesses for not providing enforcement. And the local town department had to follow up on complaints on consumers who were not following the rules. Scarce resources that could be used for other priorities, such as mitigation and testing, were used instead to follow up on complaints. The town health department does not have staff to dedicate to monitor for compliance with a local mask mandate. This is not a good use of town resources, and many other local boards of health have publicly stated the same reasoning, including Melrose, Leominster, Nantucket, Gardner, and Concord. I do not believe the mask mandate in Winchester was having an impact on transmission over the past 5 months. People have been gathering in each other's homes, going out to eat with friends, not social distancing, having parties, having sleepovers, having play dates, carpools, all with no restrictions. These behaviors are what is leading to increased transmission in our community. But in retrospect, I do think we made a few mistakes last week. People have commented that the timing of the decision was not good. In light of the new data that has emerged over the past several days about the rapid spread of Omicron, I totally agree. An increase of 73% in the circulation of Omicron across the country since the beginning of December is unprecedented. And by rescinding the mask date last week, it resulted in an unintended message to the community that it's okay to put your guard down. That is not the message that I intended to send, and I apologize for this amongst what I know is a very scary time for our residents. We also made mistakes in understanding the needed components to implement the decision. We should have spent more time deliberating about the best ways to continue messaging to the community that masks are still advised. We should have made sure that the community had access to documents, messaging, a recording of our meeting so that those that missed the meeting could understand what we talked about. We should have spent more time discussing all the components needed to roll out communications and deliverables associated with the change in policy. We should have anticipated in advance the needs and questions of the business community and allowed more time for this process before removing the mandate. And I am new. I didn't realize how long it was going to take to do all of these things. That's my fault, and I apologize. In the future, when the Board of Health enacts a new measure, I will ensure we have enough discussion and deliberation about all of the details and what the impact will be on the community and our businesses so that everybody has the information they need. But I think that we are good where we are now. We're in a whole different place than where we were last year. This December, almost 19,000 Winchester residents are fully vaccinated, and there is a very low chance that even if they contract COVID, they will get severe disease. Last December was not the same. I believe that, one more statement, sorry. I believe that aligning Winchester's mask policy with the Massachusetts Department of Public Health and the CDC is the correct course of action.
Thank you, Jennifer. Maureen, do you have some comments or?
I did, but I think that Jen just expressed exactly what I wanted to express to the community and to everybody on this call, and to allay the noise that has been put out there on social media surrounding the decision that is false information and is actually very harmful to this community. And I applaud her, and I applaud you, Kathy. It's very difficult to be on this board during a pandemic, and all of us chose to still be here and meet and try to work this town through this very difficult time. And I would like to also say that I have never stated publicly that masks do not work, that people should not be wearing masks, and that people should not be following all of the guidance that is out there. And all of Jen's sentiments are exactly what are on my notebook right here. So there's no reason to go through them again.
Okay, thank you. Okay, so now we're going to go to public comment. We have a very huge number of people on this call, which is certainly not unexpected. However, we will be allowing 15 minutes for public comment, and we ask that each person speak just for 2 minutes. Please respect the 2 minutes, and for each person to only speak once. We are also asking, because we did get a huge amount of emails, which we did all read, I just would like to acknowledge and thank you for the time in writing them. I could tell personally just how much was put into each and every one of those emails, both for and against the mask mandate. But that being said, if we would like to ask those people who have not had a chance to express their opinion that are on this call to be those that raise their hand to speak at this time. So that being said, who would like to raise their hand?
I see the hands raised. I'll call them in order.
Thanks,
that
Maureen.
they are raised.
Excellent.
So Heidi DeLeo, I have your hand first. So if you could unmute yourself and speak for 2 minutes.
Thank you. Can you hear me?
Yep.
Okay. Thank you. I appreciate what a difficult position the Board of Health is in right now. I can't imagine the worry and the frustration and what you've had to deal with in making the decisions that you have. And I appreciate that. I do disagree with lifting the mask mandate. I think that we really need to pay attention to what's happening in Winchester and how we view all of this, and not just look at a few other towns and what they're doing. We know that masks work. And I own a business in downtown Winchester, and I still want to have the mask mandate in my store. And I lose business because of it. I've lost a couple of business during the holiday season. I've had numerous customers come in. I've asked them pleasantly to wear a mask, and they basically have said there's no mandate in town, and they storm off. That hurts business. So aside from the fact that I feel that because masks work, we should be wearing them rather than vaccination status, I really think that you need to appreciate how it impacts the town and revenue to the town, and how businesses might be perceived if they want to keep the mask mandate. It's not a political decision, it's a health decision. And we risk a lot by leaving it up to the individual retailers to make that decision about whether or not to have it and whether or not to enforce it. So I really do hope that you reconsider your vote and put the mask mandate back in place, because again, we know that works and our numbers are rising. Thank you.
Next, I have Mark Sassy. I apologize if I pronounced your name incorrectly.
No, thank you. Good morning, everyone. So I'm sitting home right now with COVID because my wife contracted COVID from, boosted individuals. They were masking. The definition of insanity is continuing to do the same thing and expect a different result. I've heard a lot of language today using the words may and believe the efficacy of mask wearing. And I'm a statistically driven person. I recommend that the board and other individuals on the call look at countries and towns and the statistical incidence compared to areas that mask and don't mask. If you look at a lot of the European countries and do that comparison, it's pretty apparent. I agree with a lot of the sentiments that were being made, but I just want to emphasize that we live in America. Businesses and individuals have choice. Businesses can still mandate whether they want masks in their business, and that is their decision. It's unfair to impose somebody else's beliefs on a group that doesn't believe the same thing. And that's really what this is. This is a belief. This isn't a statistically driven consideration. Thank you all.
Thank you very much, and I hope you continue to feel well. Michael Betancourt.
First of all, I just want to say thank you to the Board of Health and our health department. As a couple of people have mentioned, I know it's a tough time to be in these roles. And I do know that there is great power that comes in these positions, especially in a 3-person board. But there's also really great responsibility that comes with making decisions, especially abrupt decisions. I watched the Board of Health meeting last week. I don't attend all of them or watch all of them. I have a sense that decisions are being made factually and responsibly. I don't think that watching that, and I watched the PowerPoint presentation over and over again, I don't think that it is consistent with the facts that were there last week. So we're saying there's new information, but I do think this information was there that justified a mask mandate staying in place longer. So to me, that presentation then just lends itself to being propaganda more than policy. And we've got to be very careful of that because there are risks to our community right now that are greater than they were in months past. I have not heard, as a select board member, these complaints about enforcement. So what I would say about that is talk to us. If there is any resources that the health department needs, the select board at any point has jumped at anything that has been requested of them. In fact, when testing was a request of many community members to keep our kids in school, we set aside $500,000 for that. And a very stingy finance committee also supported that. So we want to work with you. I don't speak for the entire board, I speak for myself. These mask mandates certainly are effective. They add a layer of comfort to a lot of our residents and even seniors who have expressed being concerned going to the grocery store, right? So that's an issue when people don't have access to food because they have fear. This is a time where there is a heightened risk. We know that. We know that from last year, and we know that from looking at the data that's in front of us. So I understand the governor, doesn't agree with the mask mandate at this time, and other communities don't. But I think we make decisions about our community here. We are a very dense community, and we ask our kids to sit in school all day with masks on. To say that it is offensive to someone that they can't put a mask on when they walk in to get a cup of coffee, and put other community members at risk while we ask our kids to do it all day long. I coach basketball too. Those kids playing masks all day, and they want to keep going to school. They want to keep going to sports activities, going to art classes, going to music performances. It is the least amount of effort for us to put our mask on our face, and I don't think it restricts our personal freedom at all. If there's enforcement that needs to be supported, the town will leave no stone unturned in supporting those efforts. There will be vast resources available. We have federal funds for this. There was a request at our last meeting for funds. I don't even think we discussed it. We just approved it because it was requested by the health department in the middle of a pandemic. So I appreciate your service, and part of that service is a willingness to listen to the community. And so I really applaud you for coming here today. I know it's not easy, but having this meeting and having this discussion is important. I would recommend a mask mandate stay in place for no shorter than January 30th until this year, and it be reviewed at that time. We can't go every week or two wondering if the mandate is going to be lifted. It creates a lot of anxiety for members of our community, and my family as well, right? My kids are wearing 2 masks today at school, right? I didn't tell them to do that. They did that. So they've had friends that have tested positive. Families have gotten it. Our numbers are going up. The concern is very real. But if we need to phase out at a period of time and people are getting fatigued, this is not the time to do that. So thank you for your service and your willingness to listen. And I apologize for taking up too much time. Thank you.
Next, we have Natasha Hochberg.
Yeah, thanks so much. So I'm an infectious disease physician and infectious disease epidemiologist. So I have lived through this pandemic. I've been taking care of patients throughout the surge, and I manage our hospital's infectious disease fellowship program. So I have borne witness to everybody having PTSD from caring for COVID patients for the past almost 2 years. So I want to just explain a few things. First is that masks do work. And if you're looking for the data on it, there's a lot of modeling studies to show the impact of both the person that's wearing the mask and the receiver on the other end, that the decrease in transmission of viral particles is significant. So you can drop it by at least 50% if just one person is wearing a mask. You can drop it even further if both people are wearing a mask. So masks work. The problem that we're facing now is that the vaccines are not going to work well enough unless everybody is boosted. So you have about a 70% drop or a 30% drop in efficacy if you're not boosted and you're not boosted recently. So we can't rely just on the fact that we have a high vaccine coverage, because we don't necessarily have a high boosted proportion of people. I think the other thing is that everyone's saying, well, we have medications, people are not going to get so sick, it's not a big deal. We actually don't. So a lot of the medications that we would use to treat COVID, we can't use to treat Omicron because of changes in the virus. So just know that our arsenal, when you come to see us in the hospital, is really limited. And the reality is that we don't have enough healthcare workers. So a lot of hospitals across the country, even in Rhode Island, Ohio, nearby places, they are running out of healthcare workers. So I think my point is just, I understand that this is a difficult decision, but I would say we really need to think about implementing every possible strategy we can. And one of those is the masks. Are the masks perfect? No, but they add to our arsenal. And so I would just really hope that you think about reinstating the mask mandate.
Thank you. I have Timothy's iPhone next.
Hi, that's me. And actually, I would like to defer to my husband, Greg, if he's on. Can we go ahead and do Greg Sawicki instead? Thanks.
Yeah, hi, good morning. My name is Greg Sawicki. I am a pediatric pulmonologist at Boston Children's Hospital, and I'm just going to echo a little bit what Dr. Hochberg just said, as well as a member of the community. As you can see, I'm actually in the hospital right now, stepped away from rounds, because this is a very important topic to me as a local resident of Winchester, and I think it's important. And I applaud the Board of Health for coming back and putting together a meeting to rediscuss the mask mandate. And I just want to reiterate what was just said, is that we know that masks are not perfect, but that masks do help reduce transmission. And the lens that I have is as a pediatrician and a pediatric specialist, taking care of kids with at-risk conditions like asthma, cystic fibrosis, and other lung diseases. And although we don't see a lot of inpatient hospital COVID yet at our children's hospitals, we're worried that that's going to continue to increase with these new variants, perhaps with less vaccination in the under 5, where it's not even possible. And we have a community that includes not just seniors and elderly and people at risk or immune compromised. We have a community with a lot of children. And having a mask mandate in place adds an extra layer of protection from parents, for family members, for others who go into stores and businesses, who need to go into stores and businesses to shop, to do whatever they need to do, and may not be able to leave their kids at home, particularly those who are under 5. If they don't have childcare for that particular moment or time, they can't just leave a kid at home. I think that layer of protection, again, not perfect, is important to be in place. And I think in the matter of all the measures that need to be put in place in terms of mitigation, distancing, ventilation, work with the schools, which I think is very important to maintain with masks. And we see lots of kids in the hospital who have no problem wearing the masks at all. And if you actually talk to 3, 4, 5, and 6-year-olds, you don't hear a lot about masks are bothering me or hurting my face. This is an adult issue that's thrust upon a lot of children. And I think it's very important to realize that in this moment, we don't wish that we were here. We wanted this to get better. We wanted Christmas to be better. But with this rise of this variant, I think what Mike Betancourt said is, keep a mask mandate in place at least for another month, and then we can reevaluate where we are epidemiologically. I think it's very important for us, for our town, for our Commonwealth, for our children to maintain that ability to protect everyone as much as possible. Thank you.
Thank you. I see Joyce Westner next.
Thank you. Thank you very much for letting me speak. I am not a doctor, but I certainly appreciate hearing from Dr. Sawicki and also from Natasha, who's an epidemiologist. And I just want to thank Jen Inferna for really coming into this and doing her best. I have no doubt that she is trying her best to make things work for everybody. However, the one thing I do take exception to is the idea that because there are many communities near us that do not have a mask mandate, that it probably makes us an island. I live up on the west side of town, right on the Arlington and Lexington line. And I was so proud when Winchester, as well as Arlington and Lexington and Belmont became, and of course, Boston and Cambridge and Somerville, became leaders in putting in the mask mandate. And those communities still have the mask mandate. And in fact, Arlington is about to put in, or at least discuss, a requirement that people have to be vaccinated in order to go into certain facilities. So I would like to think that Winchester could continue to be a leader, and that our Board of Health members who indeed are trying their best can do what Jen just said this morning, understand that this is partly a message to the residents and a message to the businesses to keep up what we're doing and don't give up yet. The end is not in sight. January and February is going to be really tough. And because I'm a senior and my husband is almost 82, I do not want to worry about that sort of transmission that could happen. There are many statistics that tell us how the transmission is happening, and I'm so sorry for the person who spoke about being sick with it at this moment. My nephew, likewise, fully vaccinated, got it too. So I'm not being frivolous here. I just hope that Jen in particular might consider what she told us about this sends the wrong message perhaps. So thank you for letting me speak.
Thank you. Next, I see Ruth Tremarchi.
Good morning. I could echo what many others have said here this morning, but in the interest of time, it's wearing down. So I'll cut to the chase. I'd like to commend the Board of Health for the courage to hold this emergency meeting to reconsider their vote last week, which rescinded the mask mandate. I agree with Mr. Betancourt that available information at the time of the last Board of Health meeting clearly indicated that it was the wrong time to lift the mandate. In addition, I personally feel that the decision-making process that unfolded during that meeting was troubling. It's not easy, however, to reverse what may have been a fervently held decision. But in light of continued compelling information brought to your attention by our community over the past week, including this morning from the president of Winchester Hospital and Doctors Hochberg and Sawicki, that now is the right time to keep masks on, I'm here to urge the Board of Health to reinstate a mask mandate for Winchester. Thank you for your time.
Next, I see Richard Nucci.
Thank you. Can you hear me?
Yep.
Okay. Rick Nucci, 1 Hawthorne Road. I'm speaking as a private citizen, and my views are my personal views and do not reflect those of the Select Board. I want to thank all of you for convening this meeting and listening to the public. I am not asking you to reinstate the mask mandate for political reasons, nor am I asking you to reinstate this mandate because of comments sent to all of us or posted on social media over the last week or to protect my reputation. I'm not asking you to do something that you are uncomfortable with because it is bad policy. I'm not asking you to make a decision based on one PhD versus the other or one study versus another. I'm asking you to reinstate the mask mandate for 2 reasons. First, I think this board is very well equipped to lead this town into the next phase of living with COVID. I think you are on the right track and look forward to engaging with you and rolling out measures to further protect this community. However, this rollout and messaging will take some time at the local level. To be effective, you need to gain the people's trust. At this very moment in time, with the numbers soaring, the uncertainty and the possibility this community is staring down another long winter, it is hard to gain that trust. Mr. Ferna, although some of us may know you and trust you, the vast members of this community must trust you first before they will listen to you. You haven't earned the community's trust yet to believe you. My fear is that this board and department will be hamstrung moving forward with the lack of trust from this ill-timed decision, as inevitably numbers will climb over the coming weeks, and whether true or false, people will blame your rescinding of the mask mandate and never trust you or hear you. I think you are putting the cart before the horse. Let's maintain the status quo and roll out this new robust plan to protect the community. Then once implemented over the next few weeks, let's consider repealing the mandate. It will go a long way in gaining the public's trust. Second, most importantly, medical professionals are asking for your help. You've heard that this morning. They're asking us to wear masks and make good choices. Some of their colleagues have spoken today and spoke out this week. They will claim it is based on science, but really I think it is based on the fact that these few still standing can't take much more. Gone are the parades, free lunches, and accolades. All that remain are the ingrained images of the daily horror and the fear it is upon them again. I am talking about our local health professionals at Winchester Hospital and beyond that live in our town. Those that when you show up with COVID or appendicitis, give you the best treatment possible, despite being physically and mentally exhausted. In rescinding this mandate at this time, with this looming uncertainty, it is a morale killer. especially when our local professionals are asking us to continue the mandate. It sends the wrong message. I please ask you and implore you to reinstate the mask mandate temporarily while we continue to transition in fighting this pandemic. Thank you.
Last one I see is Felicity Tuttle. So I think we'll cut it off there, Kathy, because I think we're over the 15 minutes at this point.
Yeah, I agree.
Okay, so Felicity, if you want to
Good,
speak.
yeah, good morning. I'm assuming you can hear me. Thank you to the many people who've spoken, and also particularly for the Board of Health so rapidly calling the emergency meeting in light of many comments that were taking place, both in terms of their meeting and otherwise. I think one of the most critical things is, as people have said, that how the degree to which the healthcare systems have been overburdened nonstop and continue to be. So surges are going to be extremely difficult for them. As I would ask that you reimpose the mask mandate, as Mike Betancourt said, until January 30th, so that there's some predictability for the, a little more than the next month. And I also say so from a personal standpoint that both my husband and I are over 70, and while we are vaccinated and have been boosted, we have several members of the family who we like to be able to see, and both have situations which make them more susceptible to a serious situation with COVID, were we to be infected and unwittingly infect them. So I take very seriously if I go into a store, not only am I masked, but the person behind the counter is masked, and that the other patrons there are going to be masked. And if they are not, I'm not going to be going in there in Winchester or wherever else, because I cannot take that risk for members of my family I adore. So I think this is really important to put in place. And I agree with the thoughts of Mr. Betancourt that if you need more help with the complaints, there should be a way to take that off your 3 shoulders and make that more helpful to the community at large. Thank you so much.
Thank you. So no other hands are raised, Kathy.
Okay, thank you, everybody. So now is the time where we will take a vote, and we will do a roll call vote. And yes,
do we have more time for discussion?
of course.
Okay, because we've just listened to some comments and
Absolutely.
I'm thinking, and so I just want to be clear that the advisory that is in place in our town requires everybody to wear masks, whether or not they're vaccinated or not. So essentially what we're talking about here is imposing fines and penalties that have never been imposed before. So that's the difference between the mandate and the advisory. So our advisory says that everybody in town and public places should be wearing masks. That is what everybody should be doing. The mandate for the past 5 months was not enforced. There were no penalties, no fines imposed, because our health department didn't have the resources, and many people have agreed that a mandate is not enforceable. What I would like to focus on is we have an advisory. We're serious about it. People are hearing messaging from the governor, the Department of Public Health, about what should be going on right now and how can we reinforce that message to our community. So can we give out signs to all of the businesses, standard signs that are from the town? Can we update the DPW sign with additional signage? Can we put plastic boards that they use for the voting around town, reminding people this is what you need to do? Signs at the dump, signs at Stop and Shop. I think it's important that we reinforce the message, but I feel like no one is hearing the fact that the advisory in town right now that aligns with the CDC and the state is that everyone needs to wear masks indoors.
So my thought on that is absolutely we should do even more than we're currently doing in terms of public messaging and signage and everything like that. But the fact that that right now is just an advisory, in my opinion, is not enough to get people, the majority of people wearing masks that should be wearing masks. I know there's some medically compromised people that for some reason are not able to wear masks, and I do respect that. But I feel that a mandate is what really gets things done in terms of limiting the transmission of this virus that is going so crazy right now. I am very grateful to the select board for their offer for help in terms of find resources for enforcement of this. I know that's a big gap that we have, and I am confident that they will help us to get the enforcement piece taken care of. I just feel that we need to have the mask mandate in order to head off further destruction from this virus.
So we've had the mask mandate for 5 months, and people that have wanted to wear masks are wearing masks, and people that haven't wanted to wear masks are not wearing masks. So that's been the effect of the mask mandate so far.
Right.
And so we're saying that we think it's important to reinstate it so that the same thing that can be happening will continue to happen.
Well, I think with the enforcement piece included more on this, that we will require people to wear masks in public. And so those people that weren't wearing them will either need to not be in public without a mask, or they will also be subjected to a fine. However, I do want to make a mention on the fines. It is not our policy to fine on the first time of a infraction, but on a second infraction, then we would be wanting to impose a fine. And I feel that is a way to get compliance. And we can talk about the fine and the amount of fine, but I am for fines if people aren't adhering to a mandate for our town and our community well-being. So we just don't, you know, I hear what you're saying about people are going to want to continue not wearing masks if they choose not to, but that's the whole point, is to get these people to wear masks if they want to be in public to help with reducing transmission of this virus.
So I just want to step in and say, I agree fully with Jen about the fact that we are in line with the state, and we are in line, and the messaging was never to take your mask off. The message was never to let your guard down. That message got translated via social media in a small group of people in this town who wanted to change the messaging of what we were actually saying. So that's the first thing. I agree with Jen that this is an unenforceable mandate, right? So we're not going to fine people. We don't have the ability to fine people. We're not going to send the police to write tickets to people. The health department doesn't have the ability to fine people. Michael Betancourt doesn't have the ability or the resources to fine people. And we're all changing the narrative back to a mandate because of the public perception. That's exactly what Mike Betancourt said to me the other day on the phone, was the repealing mandate. He does not believe, is what he said to me, that does anything for transmissibility, but it is about public perception. So for that reason, I understand why people want to put a mandate back in place. But I just want to be clear that we're putting the mandate back in place. We're not saying anything different as a board. You should be masked, you should be distancing, you should be limiting gatherings, you should be getting vaccinated, and you should be getting boosted. So the only reason we're putting a mandate or discussing putting mandate back into place is for perception.
Kathy, if I may, just because I was addressed there.
Yes, Mike, go ahead.
I'll be brief. That's not what I said, and I actually wasn't even able to get a word in edgewise in my conversation with Maureen the other day. But to that degree, the select board did vote against a mask mandate before, and we recommended, not me, but the rest of the board recommended signs and education. It didn't work. We went into the red. We had one of the highest positivity rates in the state as a result. So we know what works and what doesn't work. And maybe that was prior to the time where these members were there, but there's history there. And there's certainly history with me voting in favor of the mask mandates. I think they're effective. I think We don't remove speed limits in town when we have a tough time enforcing, speeding on Main Street, right? We figure out ways to do it because it's important, and the public expects that there are certain restrictions around our activity for their safety. So I don't personally have the resources. The town does. We had this conversation back in August that we needed to put resources towards enforcement. It doesn't feel great to have to do that, but I do think that the mask mandate has been successful. One of my friends, Ben, shared with me he was very much against the mandate, but and he goes outside of Winchester to get coffee and things like that. But he says when he does go to CVS in Winchester, he puts a mask on because he feels like people should feel safe when they go to get their medication and prescriptions. So I think that there is at least an acknowledgement at a base level that everybody sees that people are not have different situations in their life. My next door neighbor is immunocompromised. She can't get vaccinated. Does that mean that she has to take on risk when she goes to Stop and Shop? I do think that there is real fatigue with wearing masks, and we should definitely address the data and make our policy related to that. So leaving it in place indefinitely, I don't think is effective, but now couldn't be the worst time to remove it.
So I would just like to reiterate that the town advisory is that everybody should be wearing masks indoors. I don't know how that's getting lost in the dialogue here, but the town policy and the message from the Board of Health is every single person in town, if they are inside, should be wearing masks indoors. I do not think it's a good use of resources to ask money from the select board to hire a person to follow up on enforcement of a mask mandate. Jen Murphy at our last meeting talked about our strategy for 2022 and what the focus should be. She said we should be focusing, and she's also hearing this from the Department of Public Health, vaccinations and booster clinics, in-town testing clinics, more access to and distribution to home testing, especially for families in need. The whole contact tracing situation is changing. So no longer is the state going to be involved in contact tracing. We are not going to be following up with individual people who are close contacts. It is individual responsibility that is being pushed from the Department of Public Health. If someone is a close contact, you will get if you are positive for COVID, you will get a phone call from someone at the Board of Health, and you will be told it is your responsibility to follow up with your close contacts. It is your responsibility to isolate or quarantine. It is your responsibility to convey that information. We are not going to be tracking close contacts anymore. That's important messaging that I think resources need to be used for in the coming weeks. There's going to be a lot of people that are going to be getting close contact phone calls. I know that's going to happen. And I think focusing on education around that issue is more important than asking money to the select board about hiring somebody for enforcement of a mandate that can't be enforced. There's messaging around individual responsibility, and over the course of the year, more support for mental health resources. I think those are the priorities that we should be focusing on. In addition, if the state decides to strengthen its advisory to a mandate, that will automatically apply to Winchester. It'll apply to the whole state. And a statewide approach, I believe, is more effective than a one-off approach on town and town. If we decide to impose a mandate, I don't want to stop there because I don't think it's effective by itself. So we will be talking about restricting capacity in businesses, takeout service only, a lot of other things. If we really want to limit transmission in this community, there are a lot of other mitigation measures that need to happen as well.
I know I'm not supposed to speak, but I'm just going to quickly say, Ms. Inferno, I agree that if you're going to go to mitigation measures, you should go for more mitigation measures. But a mandate demonstrates leadership at the local level, that one thinks that this is real a commitment to trying to stop the spread. And I wish we didn't have to do this, but come to our hospital, see what's happening. I understand that all of us have different experiences locally, versus professionally versus what we do with our own families and what personal choices we make. But it is so important to have that leadership at the town level to demonstrate that we care about our community, that we empower our business owners, even if it's not enforceable per se, to empower business owners to feel confident that they have the town's leadership behind them. That is really important. And yes, the state may act and we may be doing things based on the state, and good for the state if they do that. And I hope they do act. But we can't rely on the state to do that either. And I think it's really important. And it boggles my mind that there are people on the Board of Health that are in healthcare that think that a mask mandate doesn't work or doesn't help. And that really upsets me as someone who is a physician who cares for children who struggle with chronic disease and could die from COVID. So please stop with the politicking and make it work. Thank you very much. And I have to go back to see patients. Bye-bye.
Thank you. Okay, I think at this time we have a good feel for what our board members feel. I wish we weren't under these circumstances. I'm sorry to everybody that we all have to be going through this. I still maintain that I strongly wish to have a mask mandate. I'd like to keep it or institute it until the 30th of January. I'd be willing to go into the third week, maybe in January, but ideally the end of January, where we would then reassess the mandate. So we would have our order just reflect that. We would not be using a benchmark with the Middlesex County benchmark that we had with the CDC. It would just be having the mandate until the end of January. So I think at this time, if it's okay with my other board members, I would like to go ahead and take the vote because I feel like, yes.
I'm sorry, questions, because this is what we didn't get to last time. Okay,
Sure.
and I don't want to make the same mistake twice. So if you would like to reinstate the mask mandate today,
Mhm.
what are the steps that need to happen to do that? And who's going to do that?
Okay, so well, if we get a vote where we have a majority that favors reinstating the mask mandate, we would reinstate it effective maybe in 2 days from now. And then the order that we would have that would be signed, obviously, would be effective until the end of January. We'd say January 30th. And we would be doing public messaging in addition to the mandate and all the other things that you had mentioned that are part of this whole package for making our community healthier. And so did you have some other questions besides what I've just laid out?
Yes, and I would say that, when we voted last time, I think we agreed that 48 hours wasn't enough to do that.
Mhm.
It should have probably been at least a week. And we know that our town health director is not available until after January. Second, I would like to know whether you and Maureen think, asking resources for enforcement, because if we're not going to enforce this, then it's just
mute.
it's
Yeah.
theater. It's theater. Okay, Mike, you've said that before. It's theater. So if we're not going to enforce it, it's theater. So do you think, Kathy and Maureen, it's a good use of resources to ask the town select board for money for someone to be giving tickets around town to people who aren't wearing masks?
I do. I don't feel that there's a lot of people that are needing this enforcement. I feel that the majority of our community agrees that wearing masks save lives. And so, yes, I do feel it's reasonable to use resources because I don't feel like it's going to be a huge amount of resources or money to do this. And we would do more on the educational campaign than anything else about why we have a mask mandate. To address the timing of when we, initiate this mandate, I agree that people are on vacation already and that it might be hard to get it done. But I think the sooner we do it is the better. So I'm willing to do what it takes to get it moving forward. So if maybe realistically, you had said a week, I think maybe we could do it in 4 days or 3 days. But I think we need to do it as soon as we can, and I will do what it takes to get it done.
Again, I'm happy to say that I want to be supportive of the community and I want to be supportive of everyone in town feeling safe I don't believe that any messaging has come from the Board of Health that we don't want the town of Winchester to be safe and that we don't want people to be wearing masks. I understand, Kathy, your point that a mandate sends a stronger message about the masks. I do not believe it's a good utilization of resources to try to enforce this. I don't believe that we're going to be ticketing people downtown. And I don't believe those who will not wear a mask right now will wear a mask under the mandate. Now, that being said, I understand that if the messaging from the Board of Health needs to be stronger for people to wear a mask, I am happy to put that messaging out there. But no, Jen, I agree with you. I don't believe that it is an enforceable mandate, and I don't believe that we should be utilizing town resources mandate on people or to be ticketing people. But that being said, the messaging surrounding a mandate, I guess I can understand that in some people's minds, even though we have said repeatedly that everyone should be wearing a mask inside in Winchester, the messaging I can understand could be stronger with a mandate.
I think we should be focusing on all the priorities that Jen discussed.
Jen, I fully agree with you.
Last week. I think the fact that we're talking about this for 2 hours, it's like the wrong conversation to have. The conversation that we should be having is let's have, I think that the schedule for the testing clinics in town is very confusing. It would be great to have Monday, Wednesday, Friday, same time every day, each of those days. People don't know when all the clinics are. I think those are the issues that we should be focusing on and strengthening the messaging.
And Jen, I fully agree with you, but in my thoughts on this, the only thing I'm honestly trying to do is calm down the noise. And I think that you're right, our messaging needs to be better. How we reach out to community needs to be better. But I think that calming down the noise is what we're being asked to do. And I think that, I think that that's the problem, is the noise right now. And I think that you and I can both agree to that, right? So
I don't make decisions based on noise.
I understand that. I fully understand that, Jen.
I don't agree it's all noise. I really don't. I think we have a lot of people that truly have the background or not even people.
Kathy, I'm not saying it's not, I'm not saying it's noise in the sense. I'm saying the messaging that we're putting out there is very clear. It is somehow being twisted into something that it's not. So I mean the noise surrounding that. I don't mean the fear of spread. I don't mean the unknown. I don't mean all of that. I'm not saying any of that. I'm saying we have been very clear with our messaging that people should be wearing masks inside, right? We've also been very clear that we can't really enforce a fine associated with this mandate, okay? And the only difference between an advisory and a mandate is enforcement of the fine. But again, if we want stronger messaging, I understand that. And if a mandate somehow translates into stronger messaging, I'm fine to do that. But again, I agree with Jen. I don't believe in trying to ask the select board to enforce something or something else. I don't believe that's a good utilization of resources. And I do hope that maybe we can get better messaging out there if we have the time to do so, and we can be focusing on something different other than this.
Okay.
Ms.
Well,
Donahue,
yes.
would you be open to taking public comment on this question of enforcement since it impacts use of residents' tax dollars?
No.
Kathy, I don't think we can just open.
Yeah, no,
randomly.
No.
Yeah.
Public comments closed.
Yeah, it is closed, but I can tell you that I disagree about the enforcement. I think we can enforce it. I think I don't see that as a stumbling block to this, but I do think the messaging does make a difference, and that the mask mandate does send a message that the people that are not willing to wear masks will now have to wear masks if they want to be in public in our towns. But we can just agree on the messaging component alone, in order to just agree that this is what having a mask mandate will take to get the messaging out there. And And we can reassess this. It's not a permanent thing at all. But I just think during this spike right now that we're going through and the continued spikes that we're going to definitely have right after the holidays when people are coming back, it's just a safe way to go for our town. And I just really would like to see this move forward with all agreeing to disagree, but knowing what our community, most of our community wants, which is the mask mandate back in place. And I will work and do whatever I need to do. I do need to mention, and I failed to do this before, and I sincerely apologize, but Jen Murphy has been incredible throughout this whole process, the director of the Board of Health. And she has tirelessly worked and not had vacations for the last 2 years. And she would support, if we do get this mask mandate passed again, whatever it takes to get it, the order moving as quickly as possible, getting the messaging out there. We will do this, I promise. So I just wanted to mention that. And I know that she will help in getting this mandate effective within the next day or so.
So from a policy perspective, when the government decides to intervene into the lives of the people and do something that is not typical, it's not usually for messaging. Okay, it's because you're intervening to actually accomplish a goal based on what the mitigation tool is.
Yes.
So it's not for messaging. So I would never advise somebody who is in a position of authority to institute a mitigation strategy through a mandate for messaging.
Okay, I can see your point, but it's not just for messaging. It's many purposes, but the most important purpose is to keep our community safe, above and beyond anything else.
But it is messaging.
Well, but wearing masks is a physical barrier to the virus.
And there's no restrictions on wearing a mask.
So can't.
This is purely public perception. And any funds that is allocated towards enforcing this is a disservice to the rest of the community.
Are we opening this up to public
No, we're
commentary
not.
now? Because there's a lot of us who would like to speak also.
Yeah, I know. And so we're not going to do that. We're going to go ahead and take our vote.
Come on now.
And we're going to let everybody get back to the holidays. Please, I respectfully ask this at this time.
And again, Jen, I'm 100% with you. I'm going to ask you to, both of you, to be united in this vote, to put a mandate back in place. Although we feel differently, but I believe sending a united message right now to the community is what we should do. Not, we can all talk this 100 different ways, but I would like to support Kathy as our chair. I would like to support you, Jen, and I would like to work really hard in the next month to get our messaging out there and have Winchester be in a better place. And but for the holiday and for the divisiveness in the community right now that stands, I would like everyone to support this decision. I would like everyone to understand that there are many sides to this argument. And I would like to be a unified board. And I'm asking you both that. And I'm asking you both to come together, and hopefully we can try to take some of the divisiveness away from what's happening right now in town. Because the message should be that we are taking care of each other. Do I believe a mandate needs to be in place for us to take care of each other? No, I don't. And I never will. And I believe that everyone in this community is trying to do the best that they can right now. So I would like us as a board to vote the mask mandate back in place. And I would like us to be united. And I would like us to move on, to move this town through this pandemic and make the best decisions for this town going forward. And Jen, I trust you. And I'm sorry that Mr. Mucci called you out and said that the people in this town may not trust you yet. I believe you've been nothing but impeccable in these 2 meetings. And I believe that your points are spot on. And I want you to know that, Kathy, I support you also. And I would like us to come together and unify and put a message out there And let's meet again on the 10th and let's discuss it again then.
Fair enough.
Fair enough.
So Kathy, if you want to call a vote.
Okay. So what say you, Maureen, for the mask mandate to become effective?
Immediately, do it immediately.
Yeah, let's just get it done.
Okay, let's not waste anyone's time. So yes, I will vote the mask mandate back in immediately. Okay, I would like to work with the two of you and Michael Betancourt and Mr. Mucci to figure out how to get this messaging out to the town immediately. And I would like to rediscuss the mandate on the 10th of January when we are meeting again.
Absolutely.
Jen?
Aye.
Thank you, Jen.
Thank you.
I know that this has been a very difficult week for all of us. And I would like very much for everyone to spend time with their families safely. I would like everyone to take every mitigation possible, test, stay home if you're ill, and wear a mask. That is the clear message that is coming from this board.
And I would just add that everyone really does need to think about gathering at the holidays. I am truly concerned about the elderly population. Omicron seems to be spreading extremely fast. And people, I think, develop symptoms even faster than with Delta. So, and I think we're probably a little bit behind in catching up with all of that data. So before you gather with your family and friends, I think the best you can do is take an at-home test. I'd advise the elderly to, even when you're with your family, to wear masks. But I do want people to feel secure if they've been vaccinated and boosted, that there's limited chance that you'll get severe illness. So anyway, sorry, public.
Yeah,
public
no, and
service
I would
message.
just like to say that I appreciate Mr. Mucci and Mr. Betancourt being on this call today. I would love them to come to our meetings going forward. I don't appreciate Mr. Betancourt saying that he couldn't get a word in advice with me, because I was actually very receptive to what he had to say. I just personally believed getting a phone call the day after a vote, because and what he had to say was not what he said on this meeting today. So I would just like to clarify that, and let's all move forward and have a wonderful holiday. Thank you very much.
Thank you for your leadership, Maureen. I appreciate it. Thank you, Kathy.
Yeah.
Thank you,
You're very
Kathy.
welcome.
Let me know what we need to do. And
let
thank
me
you to the
just-
community for coming out today.
Okay,
Yes,
so I'm
thank
just
you,
gonna, I just want to recap then. The vote was for a unanimous vote to reinstate the mask mandate effective immediately, that we will review this at our next meeting on January 10th. And I wish everybody a very, very Merry Christmas and Happy Holidays. Thank you.
Thank you.
We will close the meeting now.
Happy holidays.
Happy holidays.
Holidays.